Good morning, everyone. I'm seeing quite a number of participants log in, so we'll just give everyone another 2 minutes so that we start on time at 12. Good morning, everyone, or good afternoon. I'm seeing a number of people still joining right now, being admitted via the meeting room. So we'll just give everybody another 10 seconds so we can start on time. I hope, though, for the meantime, everybody can hear me and see me clearly.
Yes.
Good. Good.
Yes.
Yes, can
You-
see
Yes.
you, Kay.
Good.
Oh, yes.
Thank you.
Can see you too.
I can hear and see you clearly.
Good. At least internet is working today. Now, you will find that when you log into the meeting, automatically your microphones will be muted. So if you can make sure that you keep your microphones on mute, because we do have around 300 registrations. So it will be a lot of distraction otherwise. All right. Good. All right. Now let me just check. In our meeting room, how many have we got?
I'm going for webinar. On microphone.
Right. All right. Okay, so good morning once again, or good afternoon. Everybody, depends on where you are joining us from right now. And welcome to our webinar on taking care of yourself and your workforce in the face of COVID-19. So I know that over the past few weeks, we've received an awful lot of questions from HR practitioners and managers on what to do as the global COVID-19 outbreak starts to spread. And generally speaking, in Sub-Saharan Africa, we've been relatively shielded until recently. So in the last few weeks, we have seen an increasing number of cases being reported also on the continent. And so as a result of the many questions, we decided to run a webinar with all of you. So my name is Faye. I'm the Managing Director of RaboWorks Africa. But we are running this webinar together also with our partners from Thrive. So, and I'll just take a couple of seconds to just explain to you who we are, what we do normally when we're not running these kind of webinars. So RaboWorks Africa, we focus on organizational design and organizational development, as well as HR advisory. I know that many of you on this call have worked with us already. That's why you're here. And our partners from Thrive are really specialized on organizational well-being and staff health. And again, many of you have worked with the Thrive team over the past few years. So in terms of our audience here, it's quite impressive actually. We have a total of about 300 registrations and covering all the variety of countries, all the way from Kenya to also Switzerland and the United States. And furthermore, in terms of the sectors that are represented here, you can see quite a wide variety of private sector, research institutions and government agencies. So what is clear is that obviously the issue of COVID-19 doesn't matter right now, you know, which country or which industry you're in. It's something that is pertinent for all of us here. And particularly because we live in a global culture that does not normally stop for sickness, the recent shutdown and lockdowns and movement restrictions, challenges in global supply chains have really taken many organizations aback, whether that is private sector, not-for-profit, government entities, etc. So before we start, I just need to make sure that I share with you all a slight disclaimer. So it's important to note that our webinar, of course, does not replace advice from our national governments, ministries of health, CDC, or the World Health Organization. So those agencies are updating information very quickly. We know that the situation is very dynamic and all the time changing. So please do still consult the relevant entities within your country or within your region. It also does not constitute a legal opinion, to be very clear on that as well. I know many of you had sent in advanced questions for this particular webinar, and some of those questions were related to, you know, what do we do if we have to do layoffs, and questions around how long do we extend paid leave or sick leave for. As you can see, we are many different countries in this webinar and many different industries. So as much as we can give you some insight and ideas, you will always still need to consult with your legal teams or with your lawyers to make sure that that is also in line with the regulations in your country. And finally, it's not industry specific. So right now we are quite a broad audience once again. And so what we are focused on is giving broad line information around business continuity, but not specific to the airline industry or insurance or not-for-profit entities. In terms of our agenda, what we will be covering today, and many of you have seen this agenda already, is these kind of 6 areas, as well as having some time for Q&A at the end, both to respond to some of the questions that you had officially already sent in advance, but also some that might be coming up in the process of this webinar. Now, if you have questions as the webinar is ongoing, what I would request you is to just drop that into the chat function so that we can then deal with those questions, particularly the ones that are coming in quite frequently or that many people have questions about. So we'll get to that afterwards in terms of that. Also, to be clear, is that this is not really a webinar focused so much on what is COVID-19, where did it originate from, how to protect yourself with hand washing, etc. There is quite a lot of information around on that already. So we're really talking about business continuity and the psychological impact of what is happening right now. Okay. So as an HR practitioner or as a manager, you might be feeling overwhelmed right now. Those tend to be the frontline positions that many questions are coming towards, right? People are calling you and people are emailing you and getting in touch with you because they want to have answers, right? They're looking for guidance, they're looking for leadership, they're looking for reassurance. So many of you have been saying, what do I do? People are in my office or people are calling me about, what is happening? Will we lose our jobs? When will we start working from home? Who gets to work from home? And all of these kind of questions. So the reality is, of course, that those fears are real, right? And we need to be cognizant of those. In fact, a recent poll which came out this week on 17th that looked specifically about perceptions on COVID-19 in Sub-Saharan Africa found the following, right? That the levels of concern are very high amongst our populations. So Nigeria, Kenya, and South Africa being represented here in this particular graph. And not so much that people were concerned about exposure necessarily in their offices, but the main concern was in public places and in public transport situations, which is what many of your workers will be using to get to and from work. Furthermore, also is that in our continent, we are finding that many people are concerned about the financial implications. And that is particularly pertinent considering that the majority of our workforce in Sub-Saharan Africa is employed in the informal sector. In some countries that's 60 to 70%, and if we add agriculture, we sometimes hit figures of 90%. And naturally, informal sector employees don't have the cushion of paid leave or healthcare insurance, of options of staying at home for a couple of weeks. So our situation is slightly different than perhaps in other countries. So as HR practitioners and as managers, of course, the first thing is to acknowledge that the fears are real, and perhaps you yourself have the same concerns, right? Worrying about your job, your family, your loved ones, etc. So simply telling our workforce to be calm or not to worry or let's just see what's going to happen is likely not going to be enough. Especially not nowadays when people have so much access and information through different forms of media and social media and round the clock kind of being bombarded with this COVID-19. So first things first, of course, as a result, what is clear is that as HR and as managers, we need a plan. And a plan which is a lot more than just saying we are monitoring the situation. Now, the good thing in our case is that we can already pick a lot of lessons learned from China, from Asia, from Europe and North America. So in that case, as Sub-Saharan Africa, we have a kind of benefit of foresight. We can see what other countries have done, what has worked and what has not worked for them. Similarly, many of our countries already have a degree of preparedness due to, for example, the Ebola crisis. So screening at entry points is not something that is new for them. But your employees are looking for clear answers and guidance, and they really want to feel reassured by you. So panicked or knee-jerk reaction, rushed closures and cancellation, postponements of different events will not promote that sense of calm unless it is accompanied by a plan. And what was interesting, some of you might have followed the Gallup data that was released yesterday night, actually, And they were showing that even at the best of times, when things are stable, many staff don't have confidence in leadership in their organizations in terms of having a clear plan. Now, in times of uncertainty, that becomes then even worse. So the first recommendation that we have for you as HR practitioners or as managers is make sure that you help your staff to understand which kind of risk category they even fall into, right? Because not all of our workers are at the same level of risk when it comes to exposure. And so the Occupational Safety and Health Act, OSHA, suggests the following categories. And we'll share with you the actual document after this webinar, at least for those of you who have decided to receive information from us after this webinar. But what in their document you'll see it shows more like a pyramid. Here we've kind of adapted it. But they identified 4 different categories between very high and low. And when we are talking about staff who are at the very high kind of risk of exposure, here they're really referring to healthcare workers, so doctors, nurses, paramedics, or lab technicians who are actively involved in the treatment of COVID-19 patients or suspected cases of COVID-19. So that could also be people who are tasked with performing autopsies, for example, on this kind of groups. The second level is then high. So still here, we're seeing in most cases that is hospital staff or medical transporters, ambulance workers, etc. Again, that have to, by virtue of their job, come into contact with many people and potentially some of them sick. Now, in this particular webinar, when we looked at the back end in terms of the industries represented here, it is unlikely, and I say this in this way, unlikely that the majority of your staff fall into the very high or high category. The second 2 categories where we will find the majority of workers fall into is the low and medium. And those are really jobs that don't necessarily, by virtue of their role, have to interact with sick patients or potentially sick patients on a regular basis. So in the medium category, we might find, for example, staff who are frontline workers. So that could be your drivers or certain sales personnel, people who are working in a high volume retail setting, or people who are handling travelers. So that means that by virtue of their job, they need to interact with people. And then your low level, which is according to OSHA, where the majority of workers will fall into. And those are people that are in jobs that don't require close contact or frequent contact with suspected cases. So that's just a kind of start in terms of helping you to think through for your workforce, where are the majority of my workers falling into, and then making sure that you have the right protective measures in place for that. So again, I will not go into the protective measures for those different categories because CDC, WHO has very clear guidelines on what you should be providing to those different categories. But it's a good kind of way to alleviate some of the fears which might be coming up in your workforce right now, with people, you know, believing we should all be running around in a hazmat suit or gas mask or something like that. It is unlikely that your entire workforce falls into the very high risk category. In terms of then some quick actions that you can take as an HR practitioner, and the list is of course not exhaustive, but we just wanted to give you some potential options and some things to think about. Many of you already are doing some of them, and I will not go through the full list of them, but I want to pick on a couple of them here. So we're seeing more and more businesses allowing for flexi working hours, and that means really allowing your staff not to come to work during high commute hours. So to avoid that kind of rush hour of 7 a.m. or 5:30 p.m. is try to stagger that or allow flexible working hours so people start at 10 or 11 o'clock, so that when they are taking public transport, which is their main concern, it's not full. And same way, some very basic things are around staggering lunch and break time so that not everybody is congregating in your kitchen areas or in the break areas at the same time. At the bottom end on this list, a couple of things here that we are seeing many organizations picking up quite quickly. If you have a cadre of staff who are more at the lower end of your pay scale, so that could be your cleaning ladies, your security staff, your drivers, etc. One of the things to consider is putting care packages together for them. And whether those care packages now involve hand sanitizers or just basic necessities from sugar, maize flour, etc., could be an option to consider to make sure that those staff are protected, bearing in mind that normally their pay grades are at the lower end, so they might be hit a lot harder. Masks, having masks for staff who become sick. And here to be very clear, this is not masks for all of your staff, but it is in case somebody should fall sick during working hours in the office, making sure that masks are available, so at least the risk of contamination for others goes down a little bit. And for those of you who are having staff working at home, is looking at reimbursement for those internet services, if that is indeed an option. And what I would like to check with you, because some of you might already be taking some of these actions. So what we're interested to hear from you is to what extent your organization is already putting some of these actions in place. And to do that, I will just launch a poll on our end so that we can see what your organization is already doing. Or in case the poll is not working, actually what I suggest is you could just put it into the chat. So is your organization already doing any of these actions that we were just seeing there? If you just put into the chat a yes or no, that will be very helpful for us to see. Yes, yes, okay, yeah. Any organization not doing any of these things yet at all? Right, okay. So good thing then to note that the majority of us are already doing something here. Right. So then moving on from there, a lot of you are telling me about the teleworking, and I just want to cross check if you are still able to see my screen at this point. Ooh, let's have a look. Would you be able to let me know if you could still see my screen?
No, you'll need to reshare.
No, we can't.
Right, okay. Thank you very much for that.
Not yet.
Not yet. Let's have a look.
Yes, now it's clear.
It's back, eh?
Yes.
Great. All right. So let's go live again from here. In terms of teleworking, many of you have been, considering the teleworking and trying to figure out how do we do it. I know many of you have also said, well, what do I do if I'm working in an industry where teleworking is not an option, or not all staff members can somehow do teleworking. So for the teleworking, I know it's not for all of you, but for those who are considering it, what we wanted to distinguish between is the software and the people component, right? So many of you already have some of the technologies which are highlighted there on the screen. Many of them are available for free, at least up to a certain level. But the issue here is not the installation of the software and sending your people a login and a password. That's not the biggest hurdle. Rather, the biggest hurdle here is that it is a change process, right? It's an organizational change process in terms of how people are working, how they are interacting and communicating with one another. And so the big lesson here is really for us to be patient and to provide relevant staff with all the information that they need the software. So not just, FYI, here's a new login to Slack or Panopto. And so the more clarity you can give to your staff about who needs to access the various platforms, who needs to have administrative rights to be able to add people or edit kind of documents, the easier it will become. So particularly for your managers, who are the ones who are going to be communicating the most, making sure that they have that full information and the full skill set available, so that you also do not overwhelm your IT departments that then might have 400 or 500 requests coming in about issues with the particular software. I also want to make a point there about dynamic communication. And that's particularly important for all of you who are big fans of email. In this particular time, just sending out a bulk email to all your staff saying FYI or for your attention is really not what we're talking about. That is not the most helpful way of dealing with the situation. So companies that are being quite successful in the communication are doing that by either creating internal FAQs, so on your intranet, kind of what are the most frequently asked questions that your staff have, and being very clear on how often those questions are going to be updated. Is it every week? Is it every Wednesday at 12 o'clock, etc.? Doing more polls with your teams as well. So whether that's virtual surveys or polls to find out from your teams how they're coping, if they need any additional support. And doing a lot more video messaging. So whether that is through the use of something like Panopto or whatever you are using as an organization, but it's really making sure that the human element is still there. So if you are an HR practitioner or manager on this particular call, making sure that your team receives a regular video message from you is a lot more impactful than just sending out bulk emails. Not to say that bulk emails cannot be sent for kind of some core items, but the idea is to have more of a people connection as well. So with those kind of few quick actions, let's look at the business continuity element here, which is why I know a lot of you also logged into our webinar. So in terms of business, first of all, around the economic impact. And while COVID-19 is, of course, a public health threat, but increasingly, we can all acknowledge that it's also becoming an economic threat. And the United Nations Conference on Trade and Development just earlier this month identified 3 kind of channels of economic disruption that we should all be expecting and that we can already start seeing in many parts of the world. And that's on the demand, the supply, and the finance side. So on the supply chain side, naturally, many of you have already experienced disruption of your supply chains, and that has meant that manufacturing stops have started, or there's been bottlenecks in the global supply chains. Particularly for those businesses here that have moved to just in time, means that your inventory stocks have become exhausted pretty quickly. And it's not just a concern around, the manufacturing of the final goods, but also intermediary inputs. And as a result, we can start to expect that earnings will decrease, and also employment, right, in some of these manufacturing businesses might be heavily hit. I was listening to the head of Tuskys, which is a supermarket chain here in Kenya, recently speaking, and he said now they seem to be back up and running again with their supplies from China, but where they are now struggling is with items and goods coming in from Europe, naturally, and being able to restock those. On the demand side, the shifting kind of sentiments, which we're seeing very quickly, kind of move through our populations. The fear of contagion is also stopping people from spending, right? When we get afraid, we kind of try to hold on to what we've got. And this negative impact on spending particularly is being felt in the service industry. So anybody involved in conferences, workshops, meeting, travel, tourism, entertainment, leisure is taking a hit. And of course, the way economies work is that one person's spending is another person's income. So as we, as a population, spend less in those businesses have less cushion for their workforce as well. And so as we're seeing kind of reduced working hours and layoffs starting to take place, it's quite possible that households will reduce their spendings. Finally, on the finance side, as we see in any kind of crisis, there's always that rush to liquidate assets or convert assets to cash. So it might be possible that we will see a squeeze on the banks. For those of you who are in the oil and gas industry here, we have seen how the markets have been really responding badly to what's going on, even as much as governments in the West have been promising big economic bailout packages. Still, the markets don't seem to have confidence that this is going to make much difference, at least not in the near future. So even investors are, rushing to sell their shares to at least liquidate some of those assets in response to what's happening at the moment. So in line with that, or moving on, now that we've kind of seen a little bit around the economic channels of disruptions, what is likely then to happen in terms of our business continuity planning? So some kind of very key statistics for you to take note of is that it is likely that 50% of your workforce may be absent for 2 weeks or even more. And that doesn't mean that they will all be sick, but this absence is likely to happen because they also need to take care of families or loved ones that might be in isolation or in self-quarantine, or they might have transport disruptions and might not be able to come to the office in the first place. And furthermore, it's likely that between 15 to 35% of your workforce will be ill at any one time. And I want to be clear, this is not specific just to COVID-19. This is kind of in any pandemic, that these are the kind of numbers that you're looking at. So whether that it was MERS or SARS or bird flu, etc. And again, we'll share with you the actual documents behind this. This source is actually from the Canada Association, Hotel Association, and they put together quite comprehensive pandemic preparedness and response plan for businesses to really think through what does this mean, right? That 50% of your workforce is going to be absent for 2 weeks, and quite a number of them might be ill. What does that mean for you and for your business? And so we'll see that on the next slide in terms of some of the questions that you should be asking yourself. Now, I know you might be looking at these questions saying, oh, I hope she's not going to read through all of them. Don't worry, I'm not. This is for your reference. We will be sharing the slides with you afterwards as well. But I want to make sure that we are on the same kind of page, or that we're thinking about some of these things. And so it's not just about, what happens if your workforce is sick or is absent, but also have you thought about in your business how you will deal with this when other businesses that you work with, or your suppliers, your vendors, your contractors, they have the same rates of absenteeism? Then what do you do? And what are some of the essential parts of your business, right? So before we think about whether we stop or we pause or we delay, we need to be clear on our end. What are the essential parts of our business? The things that will really be the last one to shut down.
Did you say Godfrey is now better?
And as well, what are the core people that are required to keep those core functions running in our business? Now, one of the things that not all businesses are looking in so much detail is, all right, I have my core functions that are necessary. I know these are the core people that I need to run it, but what happens when those people can't make it to work? Right, so is there some kind of transversal skill set? Do you have cross-functional teams that can then take up some of these areas, or does it mean everything comes to a standstill? So a good example is perhaps around your financial procedures. If there's just 1 or 2 people who are able to process or authorize payments, what happens if they are not available anymore? And in the time where many businesses are running now on virtual platforms or are using more and more software, that is of course a key advantage, but the question we should be asking ourselves is, do any of those systems still periodically rely on some kind of physical intervention by key individuals? And if those individuals are not there, how long can I keep those systems going, right? What is my runway? Are we talking about it's a 2-day or it's a 90-day period before I need somebody else to come and intervene again? So those are some of the questions which we should be asking ourselves. Some of you might already have started this kind of planning around business continuity, but in case you haven't, start now, especially as we're seeing more and more cases coming across Sub-Saharan Africa, or also seeing more businesses being impacted by supply chain interruptions. Finally, on the issue of managing the psychological component, before I hand over to our colleagues from Thrive, who'll be talking about this a bit more, the biggest killer, of course, of productivity is fear, right? So if your staff are afraid, they're anxious, they're nervous, then likely not much is happening. So as organizations, we really need to try and mitigate the spread of that fear as far as possible. So it's not only about managing the physical health situation, but also the psychological dialogue that's going on in people's minds right now, that's going on amongst colleagues. And so I'll just give you a couple of pointers from our end based on what we've seen has been working in the business continuity and also what we are doing ourselves. And the first thing is around the talking points and communication messages for all your managers. Many of you already do this when it comes to other crises. You have a communication tree in place, you have talking points in place. This is no different. What you want to avoid is that different managers sending different messages to staff, right? Or managers themselves being in panic, and then that's causing a kind of ripple down and cascading effect onto everybody else. Establishing a pandemic action plan and also the necessary activation guidelines, right? So when will different pieces be activated? If you have a plan in place, when will you send people home, for example? What needs to be triggered before people go home? Who will be the first cohort of staff to be sent home, the second, etc., etc.? Who will make the decisions? So again, going back to the fact that your staff want that assurance from you. And so having a plan in place that you can communicate to staff and let people know we will update you once a day or once every week, whatever it is very, very helpful in managing some of those anxieties. For bigger organizations, you might already have a crisis management committee in place. This is no different. It's to have really a COVID-19 committee in place and somebody who heads that, who's the person who can really make the decisions that will then need to be followed. I don't think we can talk enough about communication. In times like this, it's really 3 times it's there. It's communicate, communicate, communicate. And you'll be seeing that on all sorts of messaging right now. But like I said, just sending out an email once to your staff is not enough. People are scared, they're worried, they need more than that. And finally, the last one I want to mention here is promote still a sense of normalcy, continuity, and stability. And what practically, because you might be saying, well, how do I do this right now? But practically what we mean is if you have already moved to working from home or you've postponed international travel and conferences, that is fine, but we can still continue them, albeit in a different format, right? So rather than saying everything canceled until further notice, we don't know what's going on, is to say, listen guys, I know we had a regional workshop planned, it's still going ahead next week, but it's going ahead via Skype or whatever. And we have 2 sessions in the morning, 2 in the afternoon, and some exercises in between. And practically, I'll give you an example. We did last year a big conference, which many of you were part of as well, by the Healing Solidarity Network. And they brought together over 1,000 people from all over the world for a conference that lasted a whole week. It was all virtual with different chat rooms, live discussions, pre-recorded discussions. So it is quite possible to continue with your meetings and your regular check-ins with your teams. I want to stop here and hand over to Erin. Erin, I'm going to stop sharing my screen so that you can go ahead and share on your end before we take questions at the end.
Okay, hi everyone. Hopefully you can see my screen coming up, about to pop up anyway. I am a clinical psychologist. I work with Thrive Worldwide, and I'll be talking to you today more about the emotional well-being of your staff and how to help both themselves and yourselves as you go through the process of handling COVID-19. So I want to start with something that Faye mentioned, which was actually managing anxiety. One of the largest effects of COVID-19 in terms of the large population of us is that our main level of anxiety has risen. So when we talk about anxiety, we don't mean worry. It's not necessarily, oh, I'm worried about my kids, I'm worried about a specific thing. It's actually a general underlying fear. So if you can imagine it, your whole body is a bit on edge, and you feel maybe you don't sleep as well. You have problems remembering your thoughts in the middle of a sentence. So it's more like a general level of anxiety, kind of a low-lying fear. And what happens is in times of uncertainty, that anxiety raises. So what does that look like? What I would love to see you do is in your chat, tell me how you've seen anxiety. And that can be in your culture, in your city, in your town, in your country, or in the workplace, or even in your family. How have you seen anxiety show up more in the past few weeks? What I'm going to talk about is what we statistically know might happen and what I've seen happen as a clinical psychologist. So one of the main things is a rise in the amount of conflicts. So if we're all a bit more anxious, sorry, it means we also have less patience with one another, and that causes more conflicts. And we have some funny, almost ridiculous stories of conflict coming out of this kind of high pressure time already. People arguing over someone sneezing that they think has COVID-19, or people arguing about who has access to what kind of remote working spaces, those kind of things. But you should expect to see a rise in conflict. The next thing, and this will happen quite frequently with you as HR leaders, is a doubt in authority. And a lot of that comes from not knowing who to believe. So we have a lot of different sources of information coming in, lots of issues with maybe we shouldn't trust people. Should we trust this version? Should we trust this version? So especially during times of crisis or times of uncertainty, you'll see a higher level of doubt in what you're saying and what you're doing. The third thing is that you'll see some honest rebellion against decisions made. What I mean by that is you'll have people that are usually great staff members not show up for meetings. Remember to keep yourselves on mute. I have some background noise. So they'll not show up for meetings, or they'll openly question why you've made the decision you have made. They'll even decide not to get work done by a deadline because they don't like it. So that kind of open rebellion is a bit higher when you have anxiety in the workplace. The next one, and this is actually really common too, is high emotions. So you'll have some people who get sad easily and they might cry in public where they would never do that. You'll have some people who might yell. That's the volatility, the anger, where they usually wouldn't do that. So those kind of unusual displays of emotion are quite common in this time as well. If you can mute your background noise, that would be great. Reactions which do not make sense. This is a common one that managers will call and try to get us to explain for them. And what basically is happening is maybe they had a normal meeting, they thought everything was going to be fine, and someone had a large overreaction to a small problem, or heard about some change happening and just had a quite a large reaction. That usually means that their anxiety has built over time and it needs to find an exit. So it used this example to find that exit. So overreactions or reactions that do not make sense, very common. And then the opposite end of that, and some of you might know this yourselves, if you have anxiety, you might not actually let it out. You might actually try to go inside with it. And that's people who look like they're withdrawing or they're shutting down. The quieter people who all of a sudden are not talking at all, are not participating in your WhatsApp groups. They've kind of gone missing a bit. Maybe they're getting work done, but you don't know, are they doing okay? They're not talking, they're not participating. That's a common reaction as well, especially for people who are afraid of getting angry or blowing up. 7, of course, your HR. So you're going to see this all throughout. Anytime you have a crisis, you're going to have major performance issues. People who procrastinate, meaning they delay on their work. They're usually good at certain things, and now they give you something that's not up to their usual standard, or they barely get it in on time. Those are classic kind of anxiety driven or high stress concerns. So I'm going to go to the chat really quickly and look at some things I think you've been saying. It's been blinking at me, so I'm hoping you've been saying some things here. Let me see if I can get to it. Let me stop sharing for a second. There we go. So low productivity, people have mentioned. A lot of time spent online looking for news. So it is a sign of anxiety to try to control. And we try to control by learning more, trying to know more. And you'll hear people go, well, I heard this. And they're having whole conversations about what do you know? Or who have you heard that from? And someone else echoed that, being overwhelmed with information. So the panic about buying hand sanitizers, we've seen that in Kenya, and I know it's happened in other East African countries, and you can tell me if it's happened in your country. That is exactly a sign of anxiety. You know, you could ask our medical doctor, but it's actually fine to wash your hands with soap and water. But people are kind of freaking out about buying hand sanitizers to have that on hand. And that is another way of trying to control their anxiety. Displaced aggression, I think I mentioned that. These are so good. This shows me that you're good, high quality HR people, that you're using these kind of terms and know this already. High emotions, irrational decisions, that's a great one. So making decisions that don't seem to really work. Yeah, increased absenteeism. So anytime there's anything going on that's stressful, you will see people get sick with other things because their immunity is lowered. And you'll also just see them need a break, what we would call a mental health break. And so they might say that they're sick, but they just need a day off. Yeah, I love this Russian buying stuff. Oh, stigma. There's a rise in stigma. So we also, when we're in high anxiety, we like to find people to blame. And I almost did this myself this morning and yesterday when I found out there were more cases in our country, which is Kenya. I was initially very angry, like, okay, who let them in? Why are they here, right? So that need to blame is also anxiety driven. And that's also what drives your team conflict, is people will want to blame things on certain people. So thanks for participating in that question. I'll move on. If those are the things you can see, you can look with your eyes and actually see this is what's happening, then what should you do? So I kind of have two suggestions here. You can be proactive on some things, and some things you'll have to be reactive on. So proactive means before bad things happen, here are the actions that we're taking. Well, a lot of that is possible because COVID-19 has just started in many of our areas. So we can be proactive on certain things. But since a lot of us are already having to work remotely and we're already stressed, some of it might have to be reactive, meaning that the conflict has already started and you're trying to react and figure out how to do that in a calm way. So I'm going to talk about both the proactive actions you can take before things get really bad and the reactive things that you can do when they are bad already, okay? So proactively, and actually Faye has said this a few times in different ways, you need to really communicate well. So something we say in terms of crisis, in terms of high stress, anxiety, is information is safety. And unfortunately, a lot of us withdraw and try to make decisions in smaller groups when we feel unsafe or stressed, and then we don't communicate very well. So information is safety means that you'll involve a lot of the staff in the decisions happening, that you'll communicate openly, that you'll even say things like, here's how we made the decision we're making, okay? So information is safety, communicate your decisions. And this is, again, this is proactive. The second one is allow for as much choice as possible. So this is a big one. None of us chose this. None of us chose for all of our kids to be home from school. None of us chose to work remotely, to be, you know, isolated if that's what's happening in your area. None of us chose for the virus to come this far. So we're already feeling like we're out of control. That means we need to feel like we have other choices available to us. So even if you say to people, okay, from now on, we're going to work from home, You need to give them choice in how to do that, how to connect, how to dial in, how to talk to people, how to talk to their teams. You also need to try to give them choice in what they're doing with their day and how flexible that is. We need to be as flexible as possible right now. And I think Matt will also echo that in his remote working conversation. Okay, number 3, ask questions. Don't assume you know. Everyone's experience during crisis is different. You might think someone is upset because of COVID-19, and it's actually because they had an argument with their spouse, right? And so we need to make sure we're not assuming what's going on. You might hear people talking behind closed doors and think, oh no, like they're upset with something, and then you assume something, and it actually is something very specific that you could have solved, okay? So always ask questions. Try to get at the bottom of why people are feeling what they're feeling, or why they've started to become more stressed. The 4th one, understand individuals. So each individual, I know you know this as HR, is very different. Again, you'll have some people who get angry, some people who read all the news, some people who don't want to hear anything. So everyone has a unique situation, a unique background. I think Faye has also mentioned this, but even remote working won't work for everybody. So how do you accommodate those people? What will that look like? You know, I myself have 4 children and they're all home right now. And basically right now I've locked the door to my room, and that's how I'm coping with it. But I can't do that for 8 hours a day. So I need someone to understand that I've got to come in and out of work time, that I can't give you devoted attention all day, every day. The next one, make visual contact. This is huge. So today you'll notice most of us have our videos off. If you decide to WhatsApp call people, or you're remote working, or you decide to have a Zoom call, try to have everyone turn on the video call. Without video, you don't really feel like you connected, okay? So again, I'm telling you, without video, you don't really feel like you connected. So if you are still able to meet in person, that's great. Make those meetings happen. If you're not, try to use the video as much as possible, okay? The 6th one, I'm sorry, I'm taking quite a while. Again, please ask me questions on the chat if you have them. Socialize informal time. So another thing that happens when we're in crisis is all we talk about is the crisis. All we talk about is deadlines and work and urgency. And we start to lose the sense of fun, the sense of informal time. How are you? All those greetings in the morning. And actually, crisis is a time when we need to have more informal time, not less. You need to check in on people more. You need to say, how are you doing? I heard that your daughter was ill. You need to have those ways of bonding even more during crisis. And the last one is create routines. So give space for processing and info. What I mean by that is new routines. So when you have a crisis happen, you'll have different things impending upon your time. Again, you'll have to have different meetings. Make sure that you have a check-in space for your staff. New routines of how you're finding out how people are doing and how they're handling the anxiety and the high stress. Okay. Any questions? I'll just make sure to keep monitoring the chat so I can add to that. Okay, so all of those are things you do before bad happens. Now, what if the conflict is happening, or people are already angry, or people are already panicking? What do you do? These are, and I can go a bit quicker through these because I think you'll understand most of these, but they're good reminders for us. First of all, model integrity and boundaries. What I mean by that is be honest and show your limits. If you don't know, you say, I don't know. And I don't know what will happen in this. I don't know where we'll be next week. Go ahead and admit that. It's okay. I think, especially in our region of the world, sometimes we think we need to make up answers if we don't have them. Don't make up the answer. Just say, we're not quite sure yet. We'll let you know tomorrow, or we'll keep you updated. Demonstrate calm reactions. So when you hear new bad news, demonstrate what it is to receive that and to think, and not to react really emotionally in that moment. So demonstrate what it looks like to be calm. You know, when you're a leader, you're modeling behavior for your staff. So when you freak out, when you have or understand what's going behind it and address it, try to figure it out. The earlier you can squash the conflict, the better your team will be. Limit negativity and misinformation. You know, we've done several of these coronavirus webinars, and the amount of misinformation happening is a bit crazy. And what that does is it causes more complaints, more negativity, more fear. So please try to limit that. If you hear it, if someone tells you it, counteract it as soon as possible. And if you hear a lot of complaints, try to have an intentional conversation about that's hopeful, about good things, about ways that your company can celebrate. Hey, we just met this deadline, or we're still able to talk about this, or do this kind of experience. Approach individuals confidentially. So if there is a problem, do not make a scene about it, right? Assume that the person has valid reasons for being anxious or angry, and talk to them in private, and really try to handle them again with integrity and kindness, compassion. And then this kind of goes with the earlier one, but take the time to make phone calls. So instead of texting or emailing, if you really have a crisis moment, call the person. I know we don't do that a lot, and we're kind of moving away from phone calls, but it's better to talk in person when things are bad that are happening. And then number 7, this one is huge. I think you could say all of the above ones with this one. Practice more forgiveness and allowances. Whereas usually you might be mad if someone has missed a deadline, maybe in this time you say, it's okay, we're all a bit slow right now. And that is how you lead in a time of kind of more heightened anxiety. Okay. And now I will go on to Matt, who will talk about occupational health considerations.
Hi, I'm Dr. Matt Edwards, who works for Thrive Worldwide. I'm the medical director for them. It's good to be with you. A lot of what I've got coming up has kind of been covered both by Faye and Erin to a degree. So we won't go through them. We'll go through the slides fairly quickly. There's some really good advice generally on what to do in a workplace, institution, getting yourself ready on the WHO website. So if you go to their website, technical guidance, and that's under the COVID-19 section, guidance for schools, workplaces and institutions, and then you go to getting workplace ready, and there's actually quite a good little article there that will give you some general sort of occupational health related things. So I think one thing just to remember is that this is although it's a difficult situation, there's lots of changes, there's lots of uncertainty, it's actually a really good opportunity. Opportunity to do things differently, opportunity to do things better. And yeah, it's just to think on Ravelwork's website, they talk about thinking outside the box, and actually there isn't a box. This is an opportunity where there isn't a box, there's no limits. You've got to work out new ways to do things within the confines and restrictions of what's going on. And it's really a time of creativity as well. Erin, if you go on to the first slide. Thank you. Oh, there we go. So general advice for organisations, unfortunately it's not prescriptive. We can't say one thing and it's going to work for everyone. You've all got different environments, different workplaces, different policies. And so, you know, you've got to take this all individually as an individual. Some of your questions again will be specific that I've seen coming up are going to be specific to your workplace, to your country. So it's going to be difficult to necessarily answer all those questions, but you need to follow your national guidelines, whatever they are, but you need to go beyond that. You need to be ready, you need to be prepared for your specific situation. Again, planning ahead. There's also a question of timing. When do you start instigating these things? When do you start trying to get people remote working, if that's doable for you and your organisation? When do you start to put these things in place? Again, I think similar to the communication side of things, it's the sooner the better quite often. Again, maintaining the trust of your employees, that comes down to the communication again. That's really important. If you're not communicating, as been said twice before, you know, people's trust reduces and there's more uncertainty. And again, you've got to consider your organisational objectives. What is it that you do? What is it you're trying to do and achieve? And how can you adapt it in this situation? Next slide, please. There's a bit of stuff next on travel, which is changing all the time, and there are lots of restrictions obviously being placed more and more. So kind of really skip over these, but there are those sort of three things to think about with travel. What are the restrictions? Keeping an eye on quarantine things, the Global Health Security Index. What are restricting? You need to restrict any people who are traveling if they have things like comorbidities, older individuals, possibly pregnant women. You know, you just need to be thinking about the duty of care and your safety of your staff. And the general consensus globally is kind of restricting all but essential travel. So just being aware of that. If you were to travel, next slide please, Erin, then there's sort of pre-travel considerations. Obviously checking your government information, the government of where you're due to be going. If you're on medication, make sure you've got enough to cover you and a bit, making sure the travel insurance is covered, and obviously being aware of health facilities and options when you're there if you need help. Next one, please. So if you're actually traveling, again, sort of more common sense things, but there may be particular screening facilities when you go in, and quite in-depth stuff nowadays, trying to get medical history, etc. Obviously, if you start to develop symptoms, then you need to isolate yourself and you need to contact your insurance company to discuss. Again, there's the general health and hygiene things, washing your hands or using alcohol gel, you know, coughing, sneezing requirements. And again, returning wise, there's more information coming out all the time with different countries about what the advice is on self-quarantining, depending on where you've been, what potential exposure you might have had. And just again, awareness of the symptoms and self-isolating if you start developing any. So if we go into sort of specifically sort of office measures, so there's certain things to think about if somebody actually in an office or a work environment actually becomes unwell. So having some facilities or options at work that you can actually sort of immediately deal with that situation. So there's the immediate thing of them being unwell, but then there's also the afterwards, making sure you clean the office well. Next slide, please, Aaron. So things you can think about doing, again, they've been covered. There's measures that to facilitate people working from home. You know, can you do things differently? Can you split your teams up so some are at home, some are at work, and you stagger people coming in, so you give them room to sort of socially distance themselves, but they're still actually able to come in. Again, flexible places of work, whether it's home or somewhere else. Changing the hours to avoid the main travel times, commuting times where you're potentially going to be exposed more. What systems are in place and advice in place for if somebody gets the symptoms. So important for self-isolating. Again, availability. Have you got availability in your workplace for people to maintain these general public health hygiene measures of washing hands, having tissues available, etc. And again, social distancing, making sure you've got a bit of distance between everyone and you're not all crammed in together. So the next bit is really talking about a bit of remote working. I know it's not possible for everyone, but you know, your objective, depending on your role, is to make sure that you and your colleagues are as safe as possible. And again, alongside that, ideally, that you're able to still provide the service that you're providing. You've obviously got a duty of care for your staff, and you want to do your best for them in the restrictions and situation that we're in. I've heard of 5 principles that can be used to help sort of make your decisions of you know, who should do remote working, how you can do it. So if we move on to those, there's the infection risk. What is the risk? Where you are, where the people are, what are the facilities available? Is the person high risk? What's the actual impact on the people you're working with, your employees? The schools closing, how's that impacting them? How are they having to adapt and provide care for their children, etc.? What's the government saying? And what are their policies on quarantining and so on? You know, the statistics earlier about 50% of people may have to be off for a certain amount of time, and you know, people are having to be off for 2 weeks. So it's just thinking about those things. Again, peer actions, what are other industries like yours doing? You know, don't just necessarily wait and watch what they're doing, but sometimes you can get some extra advice and tips, and try and share experiences. It's a really good time for organizations to, rather than be competitive, to actually help each other. And again, what it comes down to, how are you actually able to do your role, your job? The people you have employed by you, are they able to actually do their job at home, or any aspects of it? So they're the things you really need to think about. Thrive, next slide, is you know, Thrive is largely a remote working organisation, and we found it works very well for us. There are bits of face-to-face work that the doctors and psychologists occasionally do, but often most of it we do remotely. So, and if you do, as Erin said, basically if you do remote working, you've got to look for those options for helping people stay connected, because it can be quite isolating, not only physically but psychologically, and you want to keep the morale up and so on. The next slide is just a general sort of public health things to think about within your office environment, your work environment. So it's that social distancing, making sure there's that daily cleaning of areas where people are likely to touch, and there's that small risk of people contracting it that way. Frequent washing of hands, trying to avoid touching your face, and areas where if you did have the virus on you, it would be less likely to actually go in and cause a problem. Again, the coughing and sneezing into a tissue and so on, and making sure the hand washing facilities are available and well stocked. So next slide was again the forward planning. Again, Faye mentioned this. Your consideration of conferences, workshops, and so on. And again, thinking wider, thinking creatively. Can you do this remotely? Is there another way of doing this? It's just, yeah, there is opportunities and creativity that needs to be put into place here. But you also need your general plans and the contingency plans, and making sure you've set up these sort of support mechanisms for clients, organizations, people you're working with. Again, a few of the questions I think come up. Again, a lot of the things about staff and pay and so on, you've got to check your policies, your procedures, what the government say, and you've got all these factors to think about, and organizations all over the world are struggling with these things at the moment. It's your duty of care for people, whether it's locally where you're working or internationally, depending on what your organization does. And where possible, again, you're trying to promote your employees and volunteers' well-being. I think that's the end of my bit. Erin, did you want to carry on this bit?
Yes, so I know we're wanting to leave room for questions, and please, as we've said, you can continue to ask any questions in the video or in the chat. We'll try to get to some of those at the end. So I'll go a bit quicker. But there is a note, if you find that you are remote working and what we call social distancing, meaning you're keeping space between most people, or you're isolating or quarantining, meaning you've been exposed to the disease directly, the evidence is after a week, it becomes more difficult for people. So during the first week, we're all just kind of doing what we have to do. After that, you start to need routines, you start to need regular check-ins, you need to have help with your kids if you have children. So it gets a bit more difficult. So know that if you guys are planning on kind of forward thinking again, business continuity, after a week, you need to have regular routine scheduled procedures in place for how to check in with people. Lastly, what we want to talk about is the importance of self-care for you guys as HR or managers, and what that looks like. The first thing is just, how do you as an individual take care of yourself, regardless of who you are? One big thing that we're trying to get people not to forget is to help others. So actually social distancing, keeping away from people, is actually helping others if you can do that. Not everyone can, and we acknowledge that. Other ways to help others is to check in, especially on elderly neighbors who are most at risk. Again, you want to keep a distance, but you can do things like help them shop and bring things to them. You can, if you know people are at risk in your neighborhood, you can try to think through how do we carefully and safely help them. I've seen a lot of fundraisers, those kind of things. Think about how to do that. That actually helps you feel better and gets your perspective more in place. Make sure, of course, I sound like a doctor here, but make sure, of course, that you're exercising. And if it's possible to go outside, not possible for everybody because some of us live in very crowded places, but nature, as they say, is still open. It doesn't close. So, and you can get quite far away from other people in some places and go for a walk, and that's really helpful, especially for children. Again, keep a routine. I think I've said that now 5 or 6 times. Use coping mechanisms. So if you are a person who loves the gym to exercise, you'll now have to rethink about, how do I exercise? If you're a person who loves social gatherings and likes to go out, you'll now have to think, how do I host a Zoom conversation with my best friend, right? So be creative about coping mechanisms. And like we've said already, don't take in all of the news out there. You don't have to read everything to know what's happening. And that will usually just make you feel worse if you keep listening and going into the news. So as an HR or a manager, I have specific advice, and we'll share these slides later. So don't feel like we're going too fast. You can have them later. Share the burden. So just because you're a manager, a leader, HR, doesn't mean you have to do it all by yourself. And I've talked to a lot of you, and sometimes you do that. You're afraid to share. So make sure, especially during times of higher anxiety, higher disappointments, that you have someone to talk to confidentially. If that's someone at home, great. But if that's someone at work, even better, because they understand the situation. Recognize limitations and boundaries. Communicate this before it's a problem. So you might have to say, guys, I'm not going to be available this weekend for my own well-being. And go ahead and communicate that so that people understand that you won't be available. But think about all those limitations and boundaries. Are you going to work until 10 just because you're home? Or, you know, how will you think through that? Empower staff. Remind and encourage them of their capabilities. Gaps don't have to be filled by your efforts. So what I mean by this is, just because you can't see people working doesn't mean that you can't trust that they want to. And just because they're maybe having higher emotions doesn't mean that they still can't get their work done. So try to trust your employees to do the best that they can do. When you start to distrust them and take away their work or their deadlines, that actually harms performance, but it also harms your team collaboration and their own internal emotions. And then the last thing is something I love, which is when you get stuck or when things just seem overwhelming, a common phrase is to do the next right thing. So don't think a week out, don't think a month out, think about next. What's next? And make that decision. What's right for right now? So I think that's all I have. I'll go back to Faye if I can.
Thank you, Erin, and thank you, Matt, as well, for giving us those additional perspectives. So now I know people have been patiently waiting with their questions. Some people have even been saying in the chat, when are you going to answer questions? Don't just keep talking, guys. So we apologize, but we also know that we had a lot of ground to cover based on some of the things that came in advance, right? And so this is not the only webinar that we'll be running. There will be additional webinars which are looking more at legal situations in different countries, remote working, etc., etc. But one of the questions that had come in over and over again is about, how do I practically change my sick leave policies? Then, you know, everybody's saying do it, so how do I do it? Now, practically speaking, from an HR perspective, again, in line with your labor laws. But in most cases, your labor laws will mandate a fixed number, a minimum number of sick leaves that you need to give your employees. What you can start thinking about is, do you add an additional 14 days as an example on top of that, in which you will still pay your employees, because you know that 14 days is the minimum for the quarantine, right? It is not your employees' fault if they need to quarantine. It's many governments who are saying you have to quarantine. So adding those 14 days of paid sick leave into it. We are seeing some companies also allowing for additional leave days for people to take care of their families. So it might not be your staff member who is affected, but somebody else in their family that they need to look after. And so can you allow your staff to use their own personal sick days to look after a family member, for example? Some companies, again, it depends, are saying, well, in this particular crisis period, we're giving unlimited sick days to people. Bearing in mind, I can hear some people doing the calculation saying, if everybody takes unlimited sick leave, that might cost me so much money. But the reality is that not all of your employees will be sick at the same time or will need to stay at home. Remember the data I showed before, we can expect that between 50% of our workforce will be away for 2 weeks at some particular point. So that is one very practically in terms of your policies that you can look at. Again, it comes as part of your business continuity planning. So what we are seeing a lot and what many businesses are doing is planning at least for the first 90 days. It is unlikely that as of tomorrow, you need to give everybody unlimited sick leave. But if you have a 90-day plan in place that shows when different pieces will be activated, for example, that is a lot easier for yourself in terms of financial planning and also for your staff. In terms of other questions that have come in around the financial sides, what we are seeing is pay freezes right now, okay? Any kind of pay bonuses, particularly for your managers, executive bonuses are being frozen because we do not know how long the situation will take. And for many businesses, for business continuity purposes, you might want to freeze that. Freeze bonuses, freeze pay increases, or even freeze on new hiring. To say at least for the next 90 days, I am not going to bring new staff on board unless it is a business critical function like we looked at before. Without this function, I cannot even manage for 90 days. So those are some of those kind of elements. Now, people are also asking me, well, what do I do? When can I lay off staff? And again, it goes back to the 90-day planning, right? Your labor law will mandate when you can lay off staff. I know now, for example, I was reading yesterday evening, guidelines have come out for the US market and Australian market in terms of when businesses can now say, I need to lay off because my business has shut, right? In many of our cases, our national governments don't really have a provision in the labor law for what to do in a pandemic case. You know, when to evoke a force majeure or an act of God, when to invoke the 1 month notice. So again, that will be in consultation with your legal guidance. But what is pretty clear is that you cannot use this as a time to get rid of staff who you don't feel are performing, and you're using COVID-19 as a kind of cover to say, okay, let's go of these people because of COVID-19. So that's kind of it. Same way you are saying, well, what about my staff who cannot work remotely, right? I have drivers, I have cleaners, I have these kind of people that need to be in. Again, if we look back at some of the things I've mentioned, is to identify the risk exposure of all of these different levels. And then if you are still continuing with business, at least for the meantime, those staff would still be in your office, but you need to make sure that you provide them with the relevant protective gear and mechanism, and perhaps even for your cleaners or drivers allow for the staggered start time, right? Because people are afraid of being in public transport at 6 in the morning or 7, so maybe they can start at 11 or at 10 o'clock instead. Again, it will really depend on you, and I understand that from a business perspective, the first thing is saving kind of a cost. But we also need to look at the continuity and the impact on the workers. So I would not recommend we start to do a mass firing of everybody, because if after 60 days the situation goes back to normal again, you will be stuck trying to get people back to your office, and you will be seen as the employer who just, you know, got rid of everybody to save its own skin. So it's a very difficult time. I think Erin had also mentioned that, you know, we do need to be a bit more patient with our staff. Some of you had fears about remote workers. How do I ensure that they're actually working, right? And I put the question back to you. How do you ensure that your staff are working when they're actually in the office? Physically being in the office doesn't mean I'm actually producing my report or doing the analysis. It just means you can physically see me in the office. So if your workforce is generally disengaged, whether they're working at home or on the beach or in the office will not make a very big difference if you have knowledge workers, right? People whose job it is to problem solve, to design strategies. So we know that right now people might be distracted, like Erin was saying, because they've got family members at home or kids at home, so they might not be able to work the standard 8 to 5. But generally speaking, when we are touching base with people on a regular basis as managers or HR, calling, checking with people on a daily basis. How is it going? Any additional support you need? Is the software working for you? Can I get you anything else to make your job easier? You will find eventually people will get back on the wagon. The first week might be difficult. It is also a really good time right now to invest in more, let's say, capacity building at organizational level, right? You have all your workers at home or, you know, restricted movement. So this is the time where you can spend time on Zoom to update people on organizational policies, or new practices are coming in, or to check with managers on your performance management system, because we are unlikely to be distracted by all of the regular calls for meetings and disruptions in and out of our office like we are in a regular situation. Now, I have a question here, Dr. Matt, I think that is for you. And somebody's asking here the question of soap versus hand sanitizer. Is soap and water better, or are they equally good, or what do we do?
Yeah, Erin and I both responded on the chat, but basically they're both as good as each other. Possibly soap and water, if done properly, is probably slightly better. Actually, you know, the argument of alcohol sanitizer being better is not true. It's either the same, or soap and water, if done properly, is better.
And Erin, I guess a question I have here, I'm not sure if you responded to it yet already, but that was a question about, you know, how do we provide counseling services for staff right now if they want to do it face-to-face, or if there's a reluctance even to go and speak with somebody? What are some options there?
Yeah, I did respond a little bit, but you can do remote counseling with video. You can even do telephone counseling. If you're really remote and you're in the field somewhere, we do that really frequently, and we find it still helps. You know, you can still develop trust as long as you're talking and you have an uninterrupted space to do that. Yeah, it's very available.
Thank you. And I'm just looking at a couple of the other questions that are coming in here as well. So one of the questions here is about, you know, if a staff has actually tested positive for COVID-19, they have now undergone treatment. What do I do? When can I bring them back into the work environment? Dr. Matt, what are you seeing as some of the practices? What is also, you know, from a medical perspective, the right way to go about this?
Yeah, it kind of partly depends on what the country you're in is doing. But I have just literally responded and just said, essentially, if they've recovered from it and are well again, then they can go back to work as normal. Some countries are doing like a swab after having the illness to make sure that they're having a negative swab. And even some countries are saying you have to have 2 negative swabs. But essentially, once you've done their 7-day isolation, you've got better. As long as you feel well, then there shouldn't be any real limitations, and that infectious period should have gone. So it's a slightly difficult one, but essentially, if they're feeling well, their symptoms have gone, they've had at least 7 days of self-isolation, then you can treat them as normal. But again, if it's a flu-like illness, some people with a flu the symptoms will last a bit longer, feeling tired and run down, maybe for a few weeks after. So again, it's just taking that into consideration from a sort of personal self-care of that individual. But the important thing, partly again, is that people don't get this sort of feeling of ostracizing the individual because they had this, you know, they fought it off, they're well, there's no risk to anyone else once they've done that time.
Thank you. I had as well a question I want to get back to on is about leave. Some of you are asking now not about a sick leave, but about paid leave, right? Can I send my staff, can I ask my staff to take the leave which they have accumulated? Again, the first thing is let's check with our different labor laws in country, but it is a practice that we are seeing being used a lot more by HR and managers together, looking at kind of the overall leave by different departments and staff and saying, okay, now is a good time if you have a lot of leave accumulated to take your 10 days, your 15 days, so that not everybody is on leave at the same time. And second of all, remember, again, going back to that business continuity, right? So if you can see, these are the different critical functions I have, these are the skills I need to keep my business running. How can I manage it that, you know, these 5 take leave now, and then these 5, and then these 5, so we kind of rotate it over the next 90 days. So as the situation changes, you are seeing that more and more governments are actually providing guidance in terms of what you need to do. Like I said, for many governments as well, this is the first time, so the labor laws don't have that provision. As an example, very practical example, the US has very strict labor laws about discrimination. So you normally cannot ask somebody if they're ill or if they're sick, or you cannot refuse somebody a job because of an underlying condition. That has changed in the last few weeks, that now you can delay a contract because somebody has COVID-19 because they cannot safely integrate into the workforce, right? So in many cases, we're seeing that as businesses, we're still left by ourselves to kind of figure these things out as the labor laws, you know, get up to date. But it's something that I would recommend, is to look at some serious leave planning and to explain also to your staff why. I'm not sending you on leave because, but here is our full business continuity plan, and this is part of the situation. Now, a question came in as well, is about, can staff refuse to go to work because they feel it is unsafe? And the answer is absolutely yes. As an employer, you have the legal obligation, no matter where in the world, to provide your staff with a safe and secure work environment. And if your staff do not feel like you're taking the necessary precautions, your staff can refuse to go to work. But I want to put that into context. That is within reason, right? If your staff are in the very high risk category, they are frontline workers, and you are not providing them with PPE, with the personal protective gear, then of course they can decide, I don't want to go to work. But it's not about every staff deciding in their minds, I feel I am at risk behind my computer. So it's really more about, are you taking some of the basic precautions for your low risk staff, which is the hand sanitizer, the water stations, monitoring visitors when they come in, or even removing visitors. Right now might not be the time to bring in outside clients. We try and do that over phone or over, you know, webinar. So it's really showing your staff as well that you are taking all the necessary precautions. And I guess there was one more here for you, I guess, Erin. I'm trying to see. Somebody working in the infectious diseases. And so that would be somebody in that high risk or more medium risk category. And how do we support those staff?
Yeah, so Matt answered physically, talking about giving appropriate PPE equipment, appropriate safe environment, making sure they have hand cleaning facilities. A lot of that support is actually also psychologically. What we find is that they're run down and burn out a lot. So that means more frequent encouragement, thinking about flexible work hours, like maybe they do shorter, harder times more frequently. And then, of course, also help people to understand all the information that you have, communicate really well. So this is what it looks like, this is what you'll feel if something happens, and assure them that they themselves will have support if they contract. So those are all really important things. And then Matt answered a lot of the medical components of that.
Right. And I have a question here as well. I guess this will be also from our nonprofit sector, you know, looking at, you know, what do we do if donors refuse to fund us or to provide us with additional program grants? What do we do? I mean, the reality is, and that's not just for the nonprofit sector, that's also for the business sector, right? The reality is, when there's no money, there's no money. You know, and we can't continue operations. We can't pay our own rents for our offices, vehicle upkeeps, insurances, etc., etc. So that is not different for the profit or for the non-profit sector. And that if it gets to that point, then of course that will mean that layoffs will have to happen because you don't have any other option. However, having said that, I go back again to the 90-day planning, right? From today, the next 90 days, how is that going to look like? When will that situation hit? And what we are finding is that for your staff, your workforce in general, it can be very useful to be clear with them on that, right? If you have this week decided to send people home, or next week, you want to make sure that you're communicating with your staff to tell them that doesn't mean your job is coming to an end, because many people are sitting at home this week wondering, does it mean I will be fired on Monday? In most of the cases, it does not mean that. So be clear with your staff that we have runway for 60 days or 90 days. If this happens, then this will be the level of staff which needs to be let go first, followed by this one, by this one, by this one. It is much better for staff to have the information than to sit at home for 2, 3, 4 weeks with a lot of anxiety, with rumors and gossip. So I'm imagining most of the companies and organizations here, you are not in the situation that by end of day today, you need to let go of 90% of your workforce because a donor program might not be refunded, you know, that quickly. Right. And a lot of people are asking about layoffs in general. And look, what we can say honestly and openly, and as we're saying as well about the, you know, demand and supply impact of economic disruption, the reality is, yes, many companies and organizations will have to lay off workers if the situation continues the way it is. We're seeing layoffs already happening in Europe, in the US, because businesses are just not generating income. So you cannot keep running forever. Now, the impact will be different in the informal sector vis-a-vis the formal sector. As formal sector employees, many times you do have some cover, you have some mandatory minimum severance pay that your staff are entitled to, or you have pension set up for them. But the reality is that if the situation continues, not just in Sub-Saharan Africa, but in many places across the world, layoffs will have to happen. However, we are not there yet. It is not as of tomorrow. And let me see, we have 2 more minutes. Okay. What do we do? I guess, Erin, I don't know if you answered this one. This is one more for you. But what do we do if a staff pretends to be feeling well, but is not?
I just
right?
read that one.
Yeah, many have reported this because staff are afraid to lose their jobs or pay, so they come to work when they're sick. So, Erin, maybe a question for you. How can we handle that?
That one's actually really difficult. You're going, in any crisis, you'll have people that take advantage of the situation. This really goes back to your organizational culture, right? If you're all being honest about things that are difficult, if you're all saying things that you're worried about, that doesn't happen as much. It happens when people are hiding, when people are afraid. So you really actually need to go backwards and think through, why are people afraid, or why are people having to pretend in order to stay home, and think through what's causing that behavior. When it actually happens, you have to kind of go with it. We don't have lie detectors, right? So you kind of have to go with it, but try to fix the cultural issue behind that. Yeah. Are we, just a way of ending, we are sharing everything that we've talked about today, right? Yeah, great.
So as a reminder, one more time, the webinar is being recorded, so you will all get a chance to have a copy of this. For those of you who said you would like us to contact you afterwards, again, the resources, additional guidance for businesses will be shared with you, as well as also the slides. But I had one more, maybe Dr. Matt, that is for you because it's coming up quite a bit, is about what do we do with our kids, right? Is it safe to let our kids play outside with other kids? Well, what should we be doing?
Yeah, it's a really good question, and I have just written a response, but basically it's a really tricky one. You know, the point of schools being off is to try and reduce the exposure and that sort of social contact. So kids just doing exactly the same as what they would have done in school, but just outside, is not the answer, and is a high risk for spreading of the condition if it comes, you know, disease if it comes in. So it's a bit of a yes and no one, as I said on there. If you can limit it, you know, kids are kids, they're going to go out and play. There needs to be a bit of socialization, and you can't, in certain circumstances, you can't limit it, but it's doing what you can. It's balancing that risk, and it's reducing it as much as possible. So limiting the social exposure. You know, some countries, I've heard of Austria talking about social gatherings of 5 people. You know, that's some families have got to limit their, it's strange, but the US have talked about 10. The UK haven't quite put a cap on it yet, but you know, even the small groups and going to a restaurant, you know, all sorts of things are being shut down. So it's basically, yeah, it's limit it as much as possible. Don't let there be free for all out on the you know, play areas. Just, yeah, try and control it as much as possible. It's a balance of risk, and do you want your child to have that risk? Yeah, tricky one.
And teach them how to wash their hands.
Good.
Yeah. Yeah. All right, we have come to an end of our webinar. It's the first in a series, like we said before. We will continue to engage with you and take also your recommendations in terms of what would be topics you want us to deal with in future. So thank you everybody for staying in here. I think we had up to 200 people in at some point, so that's wonderful. Stay safe for the rest of your Friday, and we'll be in touch again soon.
Bye, everyone.
Bye, guys. Bye.
Bye. Bye.